Okay, so I'm going to enter my patient's room, provide privacy, knock, 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 perform hand hygiene. Good afternoon, Mr. Foley. My name is Samantha. I'm going to be the nurse taking out your IV today. Can you please tell me your name and date of birth, please? Ferdinand Foley, 92369. Ferdinand Foley, 92369. Okay, matches his bracelet. All right, so I'm going to go ahead and put gloves on. Alright, so I'm going to grab my roller clamp here and I'm going to clamp my tubing, or clamp my IV fluids. Alright, so IV fluids are clamped, so now I'm going to go ahead and remove my tubing here. Okay, and here's the lid. I would go ahead and recap these just in case they needed to be used again, or if he needed to be hooked back up. Get those out of the way. Okay, so now I'm going to get my alcohol pad here. I'm going to scrub my J-loop 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, J-loop is scrubbed. I'm going to get my flush here, unscrew the cap, connect my flush. I'm going to aspirate for blood return. Aspirating, got blood return, so now I'm going to go ahead and flush 3 to 5 mils. So pulse, 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 pulse. Perfect. So now I'm going to go ahead and clamp my J-loop. J-loop is clamped. I'm going to remove my syringe. And then at this point we have a saline lock. So I'm going to go ahead and open up my gauze here. And I'm going to start removing this dressing. So I'm going to start from the outsides of the dressing and work my way in towards the catheter. Okay. Okay, I'm done. All right, so I have my catheter stabilized, so I'm going to get one gauze. I'm going to kind of fold it up, put it over my insertion site, and I'm going to slowly remove the catheter, keeping it flush with the skin. I'm going to hold pressure for 2 to 3 minutes. While I'm holding pressure, I'm going to assess my catheter tip, and it is still intact, so we're looking good there. Now that I've held for 2 to 3 minutes, I'm going to go ahead and get a new gauze, and I'm going to fold that gauze right over there, and I'm going to get some tape, and I'm going to apply the tape or a band-aid, whatever I have. At this point, I would go ahead and throw all my trash away. I would discard of my needle or my catheter and my J-loop in the sharps container, which I will show an instructor after this video, and I would discard my IV fluids in the proper receptacle at this point. With that being said, patient is comfortable. I would put bed in a low lock position, both side rails up, call light within reach, and I would dispose of my gloves, perform hand hygiene.